Hi everyone, my name is Elise Kleckner, and I am here to present our final project for our EBP proposal. I hope you enjoy. All right, EBP proposal, lowering the maternal mortality death rate for women of color, presented by Elise Kleckner, RN, BSN. Purpose. What is EBP and how will it help this nurse and others? This term is frequently used in the nursing field and the medical community. Evidence-based practice uses a specific approach proven to work by the most current and notable research. This approach helps nurses improve their patients' lives, health, safety, and well-being. Fabian, 2024. EBP is an essential tactic because it offers the newest ways to provide exceptional care, but it is imperative in particular to this paper's EBP question. This is because of the increasingly high maternal mortality rates amongst women of color in the United States. The EBP approach could ultimately help to decrease this tragic statement. This paper and project will help to answer how. According to the National Heart, Lung, and Blood Institute, in 2021, Black, American, Indian, and Alaskan Native women up to 3 times more likely to die of pregnancy complications than white women. National Heart, Lung, and Blood Institute 2021, paragraph 2. With all of the advances in technology, how is this still happening to the women of our country? The purpose of any paper or project is to find the root of the item that is trying to be discovered. The purpose of this paper is to try and discover how maternal mortality in women of color can be lowered and what interventions will be needed to do so. What is the common factor in the care of these women that is changing a bright and happy occasion into a moment of possible darkness? Continuing on, the purpose of this project is to try and discover how maternal mortality in women of color can be lowered and what interventions will be needed to do so. Also, once again, to find the common factor. Literature review of 4 articles that were pertinent to this project. Number 1, the first article being reviewed was written by Zephyrin et al. And produced by the Commonwealth Fund. To give a brief overview of the article, it was all about what community-based plans and approaches could help in the fight to lower maternal morbidity and, at the same time, improve patient experience and outcomes, and, in turn, possibly reduce the cost of services. The beginning of the article discussed what disparities women of color faced and what predisposed them to be included in a high mortality statistic. The primary approach being used here was the increased usage of midwives or doulas more frequently due to their extremely low maternal and infant mortality rates. The article highlighted other points to improve patient access to preventative care, make access more accessible, and use evidence-based equity-centered models of care. Zephyrin et al., 2021, paragraph 4. In order for them to conduct this research, a sample group was needed. This group included minority women, in particular women of color. The research question posed here was to examine models for delivering maternity care that could improve outcomes and reduce racial inequities in maternal morbidity and mortality. Zephyrin et al., 2021, paragraph 1. This article helped provide validity to this project's central research question and produced evidence to support the topic. Much like what is being done here, the study type used was for the researcher to perform a literature review based on the maternal health outcomes linked to perinatal care models that are community-centered. The research design and instrument utilized were the care models that were being researched. Lastly, the only limitation of this research model is that the facilities providers and insurance payers may not hop on board with the needed changes. Zephyrin et al., 2021. This could prove to be a significant obstacle for policy implementers to overcome. Overall, this article provided much needed and desired information on this topic. It gave way to many thoughts on how the implementation of these models could push through this barrier that is holding our women back from having safe pregnancies. This article was relevant to the times with the publishing year of 2021. Also, the article's authors are all leaders of innovation in the field and have much knowledge on this topic. This article was a great example of what interventions could be produced to help lower the statistics and help further the education of listeners and the main question asked. Literature review number 2. Article number 2 is written by Logitis and produced by the National Library of Medicine. The author of this article is very knowledgeable and holds a PhD in this field. So this article falls into the scholarly and validity box. It was also written in 2022, so it is still relevant with the times and has reliable and up-to-date information to be learned. A brief overview of the article and to give a reason why this piece was chosen, this article took a different route to get its point out there. The author wrote this article with the specialty of midwifery in mind. This article spoke to this nurse because this is the specialty being sought after. So this piece was vital in the journey of knowledge for this nurse. Many statistics were mentioned in this article that proved the severity of change needed to protect our women and why incorporating more uses of midwives is such a huge factor in promoting this change. According to Logitis, in the US, less than 10% of all births are attended by midwives, compared to between 50 and 75% of births being attended by midwives in other developed nations. Notably, all nations which have more positive maternal health outcomes than the US. Logitis, 2022, paragraph 7. 2 questions were posed in this article. First is, why inequalities in maternal health care exist, and of critical importance, what is being done to combat them? Logitis, 2022, paragraph 1. The second one provided was, what systematic racism underpinnings are seen in the maternal healthcare specialty and the avenue that can both take down this racism and push us towards a more constructive way of change, as well as the positive impact that midwifery care has on the maternal health outcomes. Logitis, 2022, paragraph 1. Literature review number 3. This next article was written and produced by the U.S. Department of Health and Human Services. It was published in December 2020 by the National Library of Medicine. The date of 2020 makes it on the late side, but it is still very relevant to the question being asked in this paper and project. The summary of this article is like the article above and focuses on ways to stop the rise in maternal mortality. To sum it up, the article was written to educate the public on the route of pregnant patients, risk factors, and actual actions and strategies that could be taken to prevent the risk of the mother and baby dying. It should be all about the mother's health before falling pregnant and how we and everyone in maternal services can keep the mother healthy before, during, and after the baby. The question posed in this article is strategies and actions to improve maternal health and reduce maternal mortality and morbidity. U.S. Department of Health and Human Services, 2020, paragraph 1. To conclude, initially the study was thought to have no limitations. However, after more thinking by this nurse and also reviewing the article, the limitation will be the same as the above articles. These interventions will be hindered if no one participates in how they are supposed to lower the rate. Like the others, this article was essential for this project because it provided more ways to reduce the maternal mortality rate. Literature review number 4. The last article that will be reviewed was from Mesby et al. And published by the National Library of Medicine. It is dated 2023, making it the most up-to-date and relevant of all the articles reviewed. Like the others, this article is about interventions that are found to be linked to lowering maternal mortality. However, this one is different because it includes a review of systematic reviews. It also differs from the others because it is about what can be done in the United States and also in low and middle income countries. Finally, the results that were discovered will be discussed further. They were gathered from 14 systematic reviews, the attendance of a birthing partner administering antiretroviral medications to the mother for those that were positive, using mobile health facilities for rural living patients, and lastly, incentives to the facilities that use the interventions to decrease maternal mortality. Also, the increase in vaccinations during early pregnancy was an added positive. The only limitation here would be continued participation from all of the participants. This article was probably one of the most helpful for this project because it included interventions to help and studies to back it up and supply increased validity. Proposed change intervention. When conducting any research, it is vital to zero in on a certain population that is being the most affected by the problem. The EBP is trying to solve or make better. The population that is being affected is any woman of color, but specifically African American women. This project is to discuss and dissect the fact that women of color are pregnant and or having a baby are facing a strikingly higher mortality rate than any other women in different color groups, thus also increasing the likelihood of the infant expiring as well. According to a study that was performed during the years 2006 to 2016, non-Hispanic Black women are 2.6% times more likely to die from pregnancy-related complications than white women. For Black women, 25 and older, pregnancy-related mortality is about 4 times higher than it is for white women of similar ages. Adedanseno 2023, paragraph 6. Being in this field as a student during preceptorship hours for a bachelor's degree was seen 3 different times the treatment differential of these women of color that occurred at the hands of hospitalists on call. This is a travesty because it is the patient and also very likely the baby that suffers due to this neglect. As a practitioner in women's health, this nurse wants to try and change the stigma that women of color face. It is the hope that this nurse could help lower this travesty of a statistic, even if it is just in the slightest. Every woman deserves the best treatment that they can. This should be one of the happiest times in their lives, but instead it is being twisted into a nightmare. How was this project guided? What is the Iowa model and how does it pertain to this research topic? According to the National Library of Medicine, the Iowa model is a widely used framework for the implementation of evidence-based practice. Buckwalter et al., 2017, paragraph 1. This model comprises 7 steps that, if performed correctly, will help implement interventions to resolve the problems being researched. To properly perform this model, the steps that need to be performed are as follows. Find an issue and ask a question. Look for the evidence of the question. Perform a critical appraisal of the found evidence. Find the way to insert the evidence into the clinician's practice and to the preference of the patient. Implement the found interventions, study the results, and finally make the findings public. Iowa Healthcare 2024. To summarize the project's totality, the purpose, problem, clinical question, and topic were all laid out to learn from. For actual change to occur, research, study, and implementation of the findings must occur. For the women of color in America to stop dying at a tragically higher rate than any other color group, the interventions found from the study and all other studies performed by other more knowledgeable professionals need to be taken seriously and put into action. Proposed project methodology. Inclusion and exclusion criteria. The inclusion of this project was straightforward. If the patient is a woman of color who has less than satisfactory experience with the birthing process, lost a baby due to medical neglect, or unfortunately lost their lives, they were included. No exclusion factor was included. Recruitment methods. For this project, a demographics questionnaire was used as well as statistics and information pulled from public record. Setting. Knowing where you want your EBP question solution to occur is always important. This place should be somewhere where the EBP can have the most significant effect and ultimately the most tremendous amount of change. For this question, the place that it will be applied is a hospital in Memphis, Tennessee, in the women's services specialty. In particular, we will see this quest play out in this nurse's women's health hospital's labor and delivery floor and the postpartum floor. These floors will have the most significant opportunity for real change. The labor and delivery floor holds 11 beds and postpartum floor holds 20. Ethical considerations. Ethical considerations are always a big topic when conducting any type of research. Fortunately, no real ethical considerations need to be made or had due to the racial groups being studied, since this is not a study, but rather a set of interventions that have been pulled together to lower this group's maternal mortality. No considerations needed to be taken. In every research project or implementation project, there will always be an outcome and a tool that is used. The result is what the researcher expects to happen at the end of the project or what they would like to see happen. The tool is how the researcher will evaluate the results or how things have changed. For this project, many articles were looked over to identify a tool that others have used to assess interventions that were put into place to reduce maternal mortality rates for women of color. Unfortunately, only two tools could be identified. The first is the Perinatal Quality Collaborative, which starts with surveys to gather the data. This is where a person will go around to the chosen sample group and ask them questions about the project and the interventions implemented. The second tool that was found was the sisterhood method. The sisterhood method will be discussed further in this project and will be used along with the survey method to evaluate the results of this project. This method was created by Graham et al. In the later part of the 1980s. The outcome of the project is to identify the interventions that can be used to reduce the maternal mortality rate for women of color. The plan to measure the interventions to lower the mortality rate is to use a little bit of the sisterhood method and more of the Perinatal Quality Collaborative. The reason for this is that the collaborative seemed to have more reliability in the data. The evaluation part of any research project must be the most important and significant simply because the researcher can determine if their project was successful. For this study, the project will be evaluated by surveying the floor's maternal mortality rate after the inventions found in the articles gathered are implemented. It will be considered adequate if the rate decreases even a percentage after implementation. Reliability and validity. This section was included in all of the literature reviews that were discussed earlier. Significance to the field of nursing and innovation. The topic of maternal death rate of women of color is at the forefront of hot topics going around right now. This is typically considered race-pointed and is a huge detriment of the patient. The CDC has provided data that in the year 2020, the maternal death count was at 861 and then jumped to 1,205 deaths just a short year later. This leads to a 40% increase overall. Lou Bell, 2023. Also presented in the same article, the CDC stated that also in 2021, the maternal mortality rate for Black women was 69.9 deaths per 100,000 live births. This is 2.6 times higher than mortality rate for white women. Lou Bell, 2023, paragraph 3. Lastly, women of color reportedly 3 times more likely than their white counterparts to die from complications related to pregnancy that could have been prevented. This was due to chronic underlying conditions, racism, and bias thrust upon them by their healthcare providers, and ultimately their ability to access said care in the first place. Lubell, 2023. The innovation of the project was included in the literature reviews when speaking of the authors and their contributions. Conclusion. In conclusion, the minority women of America should not be afraid of dying nor or not being believed about what is wrong with them to see a doctor. The use of these tools will help in the effort to lower mortality in women of color. They should not be afraid of dying just because they became pregnant, have a baby, or receive subpar care, which leads to an extended stay in the hospital. The only way this will ever change is for the future nurses to employ the available evidence-based practice propelling us into the future. A future where pregnant women of color can go on to have happy and healthy pregnancies and an uneventful labor. As future providers, we have the unique opportunity to see what is happening and gain the knowledge to make real change. Use what is at your fingertips to help prevent unnecessary deaths. Thank you so much, and I hope you enjoyed my project. Presented lastly is all of the references.